the second request, number 2009-50-02, concerns the county's contract with Verizon or whatever provider the county uses to have mobile phone service and laptop air cards. I believe we had the information we were given was that the county uses Verizon, and that may or may not be correct. But in 2008 or 2009, question one, in 2008 or 2009, in Catawba County, and again, we'll just, for the purpose of this, we'll strike 2008 or 2009 and say this fiscal year. Okay. Did Catawba County use its Verizon contract to provide mobile phones, laptop air cards, or services to any non-county agency, organization, institution, or individual?
Okay. I don't know whether to answer that yes or no, so let me try to explain, and then we'll come to an agreement.
Okay.
The county does have Verizon for our cellular telephone service. But I'll also add, we also have a few Nextel phones, so it's not exclusively with Verizon, but we have one or two departments, with 1,200 employees. Verizon coverage varies in different parts of the county, so some prefer the Nextel and the walkie-talkies. Nevertheless, primarily our usage is with Verizon.
Right. Okay.
We have some outside entities. For example, Mental Health Partners is an outside entity that, because of state mental health reform, has gone from a county department to a state agency. It's a local managing entity which serves the region of Catawba County.
Right.
Those were former county employees, and when they were with the county, through the mental health department, would have purchased their phones, purchased their services, air cards included. Well, as of July 1st, 2008, Mental Health Partners became no longer a county department, and they were a private entity under the state mental health reform. Okay? They currently reside at First Plaza. We allowed those employees to keep their phones, and on July 1st of 2008, they are now responsible for all the services, the plans, and things of that nature. If they wanted to get new phones, they are now responsible for that. The caveat, so the answer to that would be no. However, the caveat to that is, with Verizon, we enable Mental Health Partners to be listed under the Verizon umbrella, i.e. Verizon thinks that Mental Health Partners is a separate department within the county, which allows them the multi-unit discounts and governmental discounts, and they are a governmental agency, or at least serving that purpose. They are a not-for-profit organization.
Okay.
But I wanted to clarify, we're not paying their bills, we're not seeing their bills, but under Verizon, or in Verizon's system, they are listed under the county umbrella.
Okay.
We have another organization, Catawba Valley Behavioral Health Care, which are currently residing in a county building, which is the old mental health building.
Mm-hmm.
They are receiving, of course, the telephone service, because that building is wired that way. We get the phone bills. It's part of our phone bill since it's our building, and then we bill them on a monthly basis for the local and long-distance service on a monthly basis.
Okay.
So that's kind of what we do with outside entities, and I didn't know if that answers your question, but I wanted to kind of be forthcoming with that.
Sure. Okay. So you've acknowledged that Mental Health Partners, they're just to make sure I got this correct. They at one time were a county department. With mental health reform on July 1st, 2008, they became a state agency. And basically, the employees that had county cell phones, because they were county employees at the time, basically just kept that service. But Mental Health Partners is basically paying whatever cost is associated with the service.
That is correct.
Okay. And with Catawba Valley Behavioral Health Care, you said they receive telephone service. Are you referring to local phone service, like regular landline service, or are you referring to the extra mobile phone service?
Landline,
Okay.
regular telephone, and local and long-distance
that type of, I don't really want to call it service, but they're the only ones that are using, they're the only two entities that are receiving the county's discount, so to speak, for mobile phone service through the county. Through Verizon.
Cell phone service, that's correct, yes.
Okay, okay. And, okay, so let's see, that answers kind of the first part. The second part.
Now, under number 2, you mentioned how many devices. We don't provide those to them, but I do have a number of their phones, because again, under Verizon, I know the number of phones, and actually I printed that out, the number of phones that they have, and air cards, if you're interested in that.
Okay, yeah. With mental health, are they broken down into, like, mental health, you have the number that mental health partners uses and then the number that CDBH uses, or is it like a total number altogether?
It's total, but I may be able to, let me look at it. It looks like it's combined. It is. I might be able to break that out, but I've got in total what that is. Would you like it broken out?
Well, yeah, if you're able to break it out, that would be good. If not, then a total number would be fine.
Oh, I've seen that from B. Actually, I can break that out. Yes, sir. You want to break out the number of phones between CDBH and mental health partners?
Yeah, that would be great.
Okay. But as far as cost of providing that service, there is no county cost.
Okay.
For the county.
And I'm assuming that the county also, just like with the gasoline, that there's no written agreement between mental health partners or CDBH in the county's